Hi, my name is Kunal Shah, and in this presentation I will be discussing robotic-assisted microsurgical targeted denervation of the spermatic cord. It is a lot simpler than it sounds. So why does this surgery exist? Well, studies suggest that up to 100,000 men experience chronic orchialgia annually. Chronic orchialgia is a unilateral or bilateral perpetual pain in the groin or scrotal area. Though it is difficult to pinpoint exactly where the pain emanates from, chronic orchialgia can be broken down into three major subcategories. Chronic epididymis, which is pain in the epididymis, chronic orchitis, which is pain in the testicle, or chronic scrotalgia, which is general scrotal pain. If the pain lasts up to 3 months or longer, it is confirmed orchialgia and should be assessed by a physician. Chronic orchialgia is not exactly spontaneous. Some primary causes include infection within the spermatic cord, certain medications that could have disagreed with one's body, blockage in the vas deferens resulting from stones or inflammation, nerve entrapment, varicocele, which is the inflammation of vital veins in the spermatic cord, hydrocele, or spermatocele, which are the collections of fluid around the testicle, intermittent twisting of the cord, which could lead to torsion, local abdominal pain, muscle spasms exhibited by the spermatic cord, neurological conditions, or physical trauma. Surgery is not everyone's first choice. However, when conservative, non-invasive methods fail to reduce pain after a minimum of 4 weeks, robotic denervation is highly recommended. Before surgery, patients are thoroughly assessed to determine whether or not they qualify. If positive, patients are then prescribed the proper preoperational medication by their physician, which could include painkillers to restrict blood flow and consequently make surgery much easier for the surgeon. Patients are instructed not to shave near the surgical site. In this case, it would be the groin, as it could cause irritation and obstruct the surgery. Patients are advised to refrain from eating or drinking the day before surgery as well. Patients must listen to their physician, as these are only general pre-op instructions and could vary from patient to patient. Denervation is defined as the removal of nerve supply from an organ, thus ridding of the targeted sensational input from the localized region. In this case, the surgeon will be using the Da Vinci robotic surgical system mandatorily equipped with a camera, a precise CO2 laser, and a high-pressure water jet for effective denervation of the spermatic cord. Extraneous tools may vary. The procedure begins without the robotic system and with a simple 1 to 2 cm subinguinal incision to the groin area through the subcutaneous fat, which is the immediate fat underneath the skin. The spermatic cord is then located and pulled out to the surface, where it is then held in place for dissection. This is when the robot is brought over to the right side of the patient and prepped for the robotic surgery. Targeted denervation of the spermatic cord, as opposed to traditional denervation, focuses on 3 major areas where nerves tend to cluster: the cremasteric muscle tissue, the posterior periartery tissue, and the perivasal tissue. This allows for more precise and efficient denervation. The surgeon first uses one of the robotic arms equipped with a CO2 laser to ligate and divide the cremasteric muscles circumferentially and the nerves located within it. The next steps may vary in order. The surgeon then locates the posterior periartery and ligates the tissue found around it, consequently ligating the nerve clusters within it. Finally, the surgeon locates the vas deferens, switching from the CO2 laser to a high-pressure water jet to prevent potential thermal damage to the vas deferens. The surgeon then ligates the perivasal tissue, inevitably ligating the nerve cluster found within it as well. The completed ligation of all 3 areas concludes the dissection. The spermatic cord is then wrapped in a biomatrix material designed to reduce neuroma formation and released back into the incision, where it is then sealed off with stitches. If you would like to see a detailed video of the entire procedure and learn more about the surgery, you may visit the link shown below for more information. An average of approximately 10 to 15% of patients who undergo robotic targeted denervation of the spermatic cord experience immediate pain relief that may actually take up to 2 to 3 months for most patients to experience. However, there are specific instructions that patients who undergo the surgery are required to follow. After surgery, patients are given the proper post-operation medication, typically for pain. Patients are advised to refrain from any physical activity that may cause strain on the wound or surgical site, for example, heavy lifting. Patients are instructed to abstain from drinking alcohol, as it may conflict with any post-op medication. Above all, patients are especially advised to be on the lookout for certain telltale signs of any complications. For instance, no relief even after 3 months, wound infection, bruising around the pelvic and groin area that may indicate hematoma, and etc. Keep in mind that it is very common for the testicle and cord to swell up to the size of a tennis ball, but the condition may not be severe and will naturally go away on its own in about 1 to 2 months. Most of the listed symptoms of abnormality are generally not severe and can be taken care of swiftly as long as patients notify the office. And again, patients must listen to their physician, as these are just general post-op instructions and may vary from patient to patient to ensure for a safe recovery.